Welcome back to Hey Baby and Beyond. In today's video, I want to talk to you about the induction process and what you might expect if you choose to be induced. So the induction rates in the UK are around 1 in 5, so that's 1 in 5 pregnancies are being offered induction of labour for a variety of different reasons. Now, if you do decide to accept an induction of labour, it's really important that you think about these things first, so that you can be fully prepared before you go into the induction process. So what is induction of labour? Induction of labour is not doing the whole process. What induction of labour is doing is getting the cervix from being closed to being around 3 centimetres, in hope that once you get to 3 centimetres, the labour progresses and the contractions start. But that doesn't always happen. So it's really important that you understand the different methods, how they're used, when they're used, and where they are used in a hospital setting. So let's see how induction of labour is actually done and what happens during the process. So normally you'll be invited into the antenatal unit where they're going to monitor you for around an hour. After the monitoring is okay and done, they will then do a vaginal examination to see how the cervix is at this moment in time. Now that's not just looking for dilation, it's also looking for the consistency of the cervix and if it's started to shorten, as well as dilation. And what this is going to do is determine the best method of induction for you at this moment. This is what's known as a Bishop's score. So when the method is decided, they're going to do whatever the method is, and then they're going to do another hour's monitoring just to make sure that the baby is coping with whatever has been done. So the first thing normally would be a pessary or a gel. This is a prostaglandin, a hormone inside a pessary, and what this does is it aims to soften the cervix and to start the dilation process off, as well as creating some contractions or uterine tightenings. Now the pessary or the gel can be inserted, and this can be done quite a few times. So it might be that you have one inserted, then you are monitored, and then you mobilise around for 6 hours, and then they will recheck to see what the next point of call might be. Now with the pessary or the gel, the idea is that in the 6 hours time frame, or 12 hours depending on which type you have, the idea is that by 6 hours or 12 hours later, things will have started to either happen or the progression will be shown on the Bishop's score. So at the next vaginal examination, we're looking for some changes to have happened in the cervix to show that that pessary or gel is working and doing its job. Now that's great, and the idea of that is that we're trying to get to around 3 centimetres, or if the contractions start happening, we wouldn't insert another pessary. So then it would be a case of letting things either settle down or go into the next step, which would be normally to break your waters. So the best case scenario with the pessary is that we have a pessary inserted, or 1 or 2 or 3. It starts the dilation, it starts the softening, and it also starts the contractions and labour progresses. But we know that that doesn't always happen, and it's really common if that doesn't happen that way. It can be a long process with the pessary or the gel because we know that we leave it 6 hours in between, and we know that we can maybe require quite a few of those. So the next step would be, if the pessary's worked and we've got to 3 centimetres but we're not seeing anything else, then we would be thinking about breaking the waters. And breaking the waters is also another induction form. If you went to be induced and you was already at around 2 to 3 centimetres, the next step instead of a pessary would normally be to break your waters. So the aim of the pessary or the gel is to create the cervix starting to make changes, soften, thin, and shorten, and also dilation. But if you've already got the dilation there, we don't need to introduce a pessary or a gel to create the dilation. So sometimes at this point, you might be put on a waiting list for labour ward, and this waiting list can sometimes carry on for quite a few days, because if your waters are still in place and they haven't gone, and you're not having contractions, and you've quite well and your baby's well, then you would technically be at the bottom of that list for induction on labour ward. So this again can increase that stay and that time a little bit, which can be really frustrating when you sat waiting around. So the next step would be labour ward, and on labour ward you're always in your own room and you always have your own toilet. Now remembering that induction of labour is going to take you away from the midwife-led care, so it's really not used often to go to a birth centre. It would possibly be an option if the one pessary worked and you didn't require anything else, but most commonly people will go to labour ward because we need to up that level of care, and the baby probably will require a little bit more monitoring. So when you're in labour ward, someone will offer to break your waters usually. Now, breaking the waters is also a method that we can speed up contractions. So breaking waters isn't just an induction method. It's not just something you'll see in induction. It's also something that you might see in spontaneous labour. Because if your waters are what we call bulging under the baby's head, by breaking these waters, normally the head drops down and things speed up quite a lot, as well as a release of hormones when the waters go. So this is again a really useful tool if you want it and if you're happy to have it. So in induction, you've had the pessary upstairs, or you've had whatever, or you've gone in and you're 3 centimetres, you've gone to labour ward. The next step is to break the waters in hope that it's going to stimulate the contractions to start and cause changes down below. Now, normally it will be given an hour or two to see if this happens, but if this doesn't happen naturally, we then need to introduce the hormone drip. Now, the hormone drip is another all-rounder. Hormone drip can be used for induction or as part of the induction process, but it can also be used during spontaneous labour to speed things up if need be during the labour. Now, the hormone drip, things to remember with that are that we do need to monitor the baby to check that the baby's coping well with the contractions. Once that hormone drip is put in place, the only way with that is up. So we're going to increase the strength of the contractions as if your body was naturally doing so. So yes, it will become more uncomfortable. Yes, you might have to dig a bit deeper with your pain relief options, and your birth partner at this point is going to be crucial to get you through this next part. So the aim of the drip is to increase contraction strength and to make things happen and make your tummy contract. So without this, we're not going to meet our baby. So you've just got to think that if we get this and we use it, then we need to be aware of what it does and why it's doing what it does. So the idea is it's going to strengthen contractions and it's going to power those contractions. So we can't turn this off now. Once this drip is started, it's continuous all the way through until the baby arrives, because if we turned it off, the contractions would stop. The other thing just to note with this is that although it's called an oxytocin drip, because oxytocin stimulates contractions, it doesn't cross the brain barrier. So you're not going to get the feel-good factors of an oxytocin boost, unfortunately. So you do need to dig deep and think, how can I create that response naturally in my body by doing normal oxytocin releasing things, such as changing the environment, using positions, using music, relaxation, massage, upwards positions. All those things that we talk about in the very, very early stages of labour come to play in all of this. Now, remember that the hormone drip can be used as a labour accelerator in a spontaneous labour, and it's not something that will always be required during an induction. It's just something to be aware of, that often if the contractions don't happen and don't start on their own, we do need to make those happen, and the hormone drip is what that is there for. So induction on a whole is not a one size fits all. You might see one method, you might see all the methods, you might see 2 methods. It might work really quickly, it might work really slowly, it can be really quite intense, or it can be quite manageable. There's just no way of saying how induction is going to be. Now, if the induction process doesn't work and things don't progress, that would be when we need to think about other options, such as an unplanned caesarean birth, or if we're near the end, it might be some kind of assisted birth, such as forceps or ventouse. So it's not a one size fits all, and it's really, really important that you go in to induction being completely informed and knowing about what each thing does, why it does it, and at what step of the part will the next bit come, because being in control of your induction process is really, really important. So I hope you found that useful. Don't forget to like this video, subscribe to the channel, and if you're not already, following on the Instagram and on the TikTok page, where there's lots more other useful bits of information that might help you during your journey. Do comment any questions that you've got below in the comment section, and I will always be happy to answer any further questions you've got around induction, labour, birth, early parenting, whatever it is, then I'm here to help.